Hi, everybody. This is Eva Wilson from SocaMom.com, and welcome to this session of the SocaMom Summit. I'm here with 4 fabulous doctors from all around the Caribbean. We have Dr. Renee, Dr. Randi, Dr. Cindy, and Dr. Kelly. So they're going to introduce themselves and talk to you a little bit today about the impact on our community that COVID-19 is having. So ladies, doctors, go ahead and introduce yourselves.
Hi, I'm Dr. Renee. I am a medical doctor. I don't practice medicine. I actually do media for a living. So I talk about health on TV, radio, print, and online media. And I also do PR for other physicians. I am representing the fabulous island of Antigua.
Right. Hi, everyone. I am Dr. Randi. I am a board certified pediatrician and financial wellness expert. I provide your RX to wealth and financial well-being through my coaching programs, my speaking engagements, and my #1 best-selling book, Ladynomics, A Woman's Prescription for Wealth and Well-being. And I am representing the island of Jamaica and the Republic of Brooklyn, because that's where I was born.
Hi, everyone. I'm Dr. Cindy. I'm a board certified obstetrician, gynecologist, and fertility specialist. I'm also a telemedicine expert, and I'm here today to just share what I know about the Caribbean diaspora, and I'm representing Trinidad and Tobago.
Hi, everyone. I am Dr. Kelly. I'm your board certified endocrinologist. I treat patients who have diabetes and other hormonal conditions. I also help high-performing women overcome past hurt to finally get the fulfilling, happy relationship that they desire. And I also have my best-selling book, and I'll talk about it later. And I'm representing the beautiful, beautiful, beautiful island of Barbados.
Woohoo!
So ladies, let's get started right away. So there's so much going on right now, within the world, even including the lovely Caribbean islands. But we need to talk about, if you are having symptoms and you're not feeling so well, what should you do? And that means if you're living in Brooklyn or if you're living on the island, what should you do? So that's telemedicine wise. That's, if you have any problems with, some people are a little gun shy because of citizenship to go to the ER, where can we go get help?
Well, telemedicine-wise, there's actually a wonderful company run by someone from Jamaica originally, Rodocs, ROWEDOCS. And you don't require health insurance to be seen by a doctor on rodocs.com. It's telemedicine, so you can log on, put in your information. They immediately call you back, and they can set up an appointment for you to see a doctor via telephone or over the internet on your computer if you prefer. And so there's no insurance requirement. There's no worry about that. If you have insurance, of course, they accept it, but it's not required.
So this is Dr. Randi, and I am a pediatrician. I'm here in New York City, the epicenter right now of COVID-19. We have over 100 I don't even know what the number today is, but yesterday was 113,000 cases. But I'm a pediatrician. I work for a federally qualified health clinic. We have, clinics in Brooklyn, all over this New York City, Brooklyn, Queens, the Bronx, Staten Island. I personally work in our Staten Island office, in our Brooklyn office, not our Staten Island office, and our Bronx office. But what I love about our clinic is that we see patients regardless of status and regardless of your insurance status. So anyone can walk in and we will see them. Now, because of what's happening, with the pandemic, we have cut back on person-to-person visits. We're doing a lot of telehealth. 85% of our visits are telehealth. So well visits. I'm a pediatrician. I still want my kids to get their vaccines, which is so important. And so those kids, so we, ask for them to come in. But if you're sick, you can walk right into our clinic and we will see you. So those are options there as well.
So what about families that have mixed citizenship? So maybe mom and dad are not citizens, but the children were born in the U.S. What do you recommend? Because Dr. Randi, I know you have some thoughts on that.
Well, yeah, again, the clinics, the federally qualified health clinics, the community centers, definitely in New York, definitely, the one that I work for, do accept, like I said, any mixed status, anyone who walks off the street can come in and be serviced by us. It's a great option. And you can be seen, we could have the visit via telehealth where, I'll call or, we go through video. We just started this service. It's definitely out there. So definitely reach out to one of the community clinics in your area, especially the community health clinics.
So does anyone else want to add to this?
Well, yes, I agree with the community health clinics and telehealth. I think if you're in a place where it doesn't feel like that is available to you, or if you're not very familiar with your location, then RoDocs is an option because they serve all 50 states. They can also find you local centers. If you have insurance or a member of your family has insurance while you don't, they can also help you navigate that to figure out if your insurance has a specific number that you need to call, because some insurances do have their specified telehealth services. And so if that's the case, then they can help you navigate that as well. Anywhere in the United States as well.
So with what's going on right now with COVID-19, we've seen it really has affected everyone. I mean, here in Chicago, we had an infant that died recently. So it really does span the entire, age from birth to, to 90, 100 years old. So I know that there are health disparities that are especially common in our community that make you even more susceptible to not, if you do get COVID-19, to not being able to fight it off and to recover. So some of those health disparities I know are obesity. So I really encourage everyone, while we are locked in, because I know all of the Caribbean islands are locked down, just like we are here in the state of Illinois. And I mean, they even have curfews, which I really do think that we need to implement here. But obesity, you need to make sure, and I know that this is the craziest time, but try to actually come out of this losing a few pounds. So as a family, why don't you guys get up and do yoga, or why don't you just use the cans in the cupboard as weights and do some weights, do a little exercise, put on some soca and just jam out for like 30 minutes, maybe twice a day. That would be great exercise every day if you did that. If you can walk around your house, we want to do social distancing. So you and your family, if you can get outside and walk around the house and get your steps in. I am a religious wearer of my Fitbit. So try and get your steps in. 10,000 steps a day will maintain. And if you want to lose weight, you need to get more than 10,000 a day, but just make sure you exercise and let's eat healthy. So, let's not eat so many, fried foods, but let's try to eat more of the wonderful fruits and vegetables that we have available to us, and, try to eat as healthy as we can. I know you want to snack because this is the craziest time ever, but let's try to eat healthy and keep ourselves together, because obesity is one of the underlying conditions that some people have not recovered from COVID-19 because that's what they had. Dr. Kelly, I know you wanted to talk about another one.
Yes, diabetes is also one of those risk factors that are leading to worse outcomes with COVID-19. Recent data coming out of Louisiana showed that 41% of their patients who died actually had diabetes. So if you have diabetes, now is the best time for you to get your numbers under control. As Dr. Renee just said, you need to go out and exercise if you can. If you can do it at home, perfect. If you're someone that likes to go out in nature, that will also help your mental and emotional health as well. Still try to maintain the 6 feet social distancing, however. I know from Caribbean, we like our sweet stuff. We like our sugar cakes. We like our sorrel or mavi or very, very sugary drinks. That's not the best thing for you to be having right now, because they will certainly raise your blood sugar. So fruits, fruit in moderation, vegetables, drink lots of water, make sure you get enough sleep. All of those things will definitely help to improve your immune system and reduce the risk of having a negative outcome from COVID-19.
Any other health disparities you guys wanted to talk about?
Well, high blood pressure, hypertension is very prevalent amongst people from the Caribbean and the Caribbean diaspora. So it's really important that we also talk about that. As Dr. Kelly said, the data coming out of Louisiana showed that 41% of the patients who passed away or were in the hospital in the intensive care unit had underlying diabetes. But the other things that made up the other 59% were hypertension, lung disease, so asthma, emphysema, and people who were chronic smokers. And the Centers for Disease Control also just released a report yesterday with preliminary data that further supports that seems to be what's happening around the United States. 78% of the people who've passed away have passed away with underlying disease. Those are the people who had COVID-19 and passed away. And lastly, what they also saw was that for a lot of people, the thing that brought them to the hospital was late presentation of symptoms. And so if you're at home and you have these underlying illnesses and you're starting to feel a fever, some other symptoms, don't wait on it. Don't just drink home remedies, which we'll talk about, but actually use your telemedicine, call in and talk to people, because this is also hitting people of African heritage very, very hard.
Yes, the numbers have come out that unfortunately Black people are dying disproportionately to other races. So we definitely want to make sure we take it very seriously. If you have a low-grade fever, so that's between 98.6 and 100.4, that is a low-grade fever, shortness of breath, and coughing. Those are the three main symptoms. There are other symptoms, but those three, you might want to definitely get into telemedicine and call someone and just see if they triage you and see if they decide that you need to go to the emergency room. So it's Dr. Cindy mentioned, there are lots of home remedies out there. We know we're from the islands. So, I totally do believe that bush tea is the end all and be all, but bush tea may not cure you of COVID-19, but bush tea might help you to keep your immune system, I think, up to par. What do you ladies think?
I do. I'm a huge bush tea proponent. As somebody who studied microbiology and immunology, I can tell you that bush tea does have some immune boosting abilities, and it can, in fact, boost the foot soldiers of your immune system. So while you need your specialized immune cells to fight off the infection once it's in your body, there are some regular cells that aren't specialized that are the ones that are supposed to recognize an initial infection. They're not specialized. They're like the watchmen. And so we need those. And that's what bush tea and some supplements like zinc can really help to boost. And so if you're looking for ways to help boost your immune system, to help prevent infection, that's what I'm talking about. But certainly if you're home with symptoms, don't just sit and drink your bush tea. Absolutely not.
Any other remedies that you guys know of? Dr. Randi, Dr. Kelly?
I am a honey person. I get my honey straight from Jamaica. And there's been studies to show that honey has like antimicrobial, antiviral properties. So if, say, for example, you've been diagnosed with COVID-19, but you have mild symptoms, so you just want to, just feel better while you're fighting the virus. I'm a big proponent of like tea, honey and tea with some lemon. I know when I'm around sick kids all the time. So whenever I'm feeling a little bit under the weather, that's my go-to.
Dr. Kelly?
So for me, as Dr. Cindy said, zinc. I also take my vitamin C tablet every single day. If you don't have access, or some people just can't go out and buy supplements or vitamins like that, just have a healthy diet. You can just try to buy all colors of the rainbow. So yes. Get your oranges. What else? Get your apples. Just try to have a healthy diet during this time.
Yes, and one word of caution for the honey and diabetics, right? Watch yourself with the honey, and definitely be taking your diabetes medicine so that your sugar is under control.
And you don't give honey to kids under the age of 12 months. That's very important to add. Very important to add. But I do
Go ahead. No, go ahead.
I just want to add one more thing in terms of preventive health to keep yourself healthy. If you are asthmatic, because I see asthmatic children all the time, make sure your asthma is under control. Okay. Yes. Take if you're on control of medicine, that's medicine that you take every day. Make sure you're on that. If you're on allergy medicine, because the thing with COVID, it's happening during the time when it's like we're at the end of flu season, it's during allergy season, and then we have these COVID, and all the symptoms kind of mimic each other or overlap. So try to make sure you control. If you have allergy symptoms, every year this time you're having allergy symptoms, take your allergy medicine. If you're asthmatic, because we know if it's COVID, whether it's flu, asthmatic always have a higher risk factor of increased morbidity. So definitely whatever, seasonal issues that you have going, make sure you have those under control so that at least you can rule that out. And then it won't affect your prognosis if you should happen to catch the virus.
I myself am an asthmatic, and so my asthma is very much under control, but I have just been making sure that I don't feel any different, because if I feel different, then I know that I need to go. And everyone should have an asthma action plan. So you should know that when you're in your yellow zone, you should know when that is, and you should definitely call the doctor, because you do not want to get in the red zone. I will tell you that right now, especially in the US, but right now, if you go to the emergency room and need a breathing treatment, there are probably 90% chance that they're not going to give you one because of the whole aerosol thing. I've heard of people being turned away because they're not using nebulizers right now because this is an airborne disease with the respiratory droplets. So they would send you with a prescription to go and take the breathing treatments at home. So you want to make certain that you take care of yourself, because it's going to be very difficult for you to get the treatment that you usually would in the ER as an asthmatic right now. So be very careful.
Very good point.
Agreed. Part of that action plan is every home should have a thermometer. Whether you have kids in the house or not, get a thermometer. If you have a history of high blood pressure and you haven't yet gotten yourself a blood pressure cuff for home, get one. You can even get it through your prescription if you have insurance, but they're really quite affordable even if you're buying out of pocket. And if you are diabetic, you should have a glucometer at home. You definitely should at this point.
And there was one last home remedy I thought about. My grandfather, may he rest in peace, he took garlic. He was told he had high blood pressure. He didn't take any medications. He took garlic. Now, garlic may do a whole lot of great things, because we've all heard garlic does a lot of great things, but it is not in substitution of the blood pressure medication that your doctors prescribe you. So please, yes, if you're healthy and wonderful and you want to eat garlic every day, I'm sure it's going to keep your immune system boosted and it'll help you. But if you've been diagnosed with having high blood pressure and you start having any other comorbidities due to your high blood pressure, the first thing you want to do is to make certain you follow your doctor's orders, which leads me to the discussion of, I know that we have all been receiving all sorts of crazy medical information via WhatsApp from our relatives overseas. And I just wanted to talk about, there's been all sorts of rumors and strange theories coming out. And we, as 4 physicians, want to tell you the truth. So Dr. Cindy, as the virologist of the group, would you like to start with that?
Yes. Well, the first thing I want to say, guys, is COVID-19 coronavirus is real. Okay. It's real. It's not made up. It's not a conspiracy. It's not 5G radiation from cell phone towers. Don't go out there destroying your cell phone towers or setting them on fire like's happening in the United Kingdom right now. Don't do it. That's not what's causing it. It's real. And also, Black people, people of color, are not immune to coronavirus infection. We can be infected and we can get quite sick with COVID-19 disease. We need to know that. There are a bunch of other myths, but I feel like those are the big ones. I really want to make sure that everybody hears the virus is real. Don't discount that it's there. It's here. It's here. And we can debate later where it came from, but it's real.
Yeah.
Exactly. So please, there's a whole lot of, as she said, conspiracy theorists out there that are putting videos and sending messages via WhatsApp, via, Facebook and everything. Please make certain when you read any of this information or watch these videos, look at the source. Make certain that this is either a medical doctor, someone from the CDC, Center for Disease Control, or the World Health Organization, because those are the places where the truth is coming from. All these other people and their ideas and their thoughts, they have no bearing, and they have nothing to back it up. So the science is telling us that this is a virus. Maybe we should have started off talking about exactly what it is, but it's a virus. COVID-19 is part of a family of viruses. The coronavirus is a family of viruses. COVID-19 is actually SARS-2, if you remember SARS back in the day. And so it's just a crazy strain of coronavirus, because coronavirus really usually just causes a normal common cold. But this is a strain that has just been really ravaging and just wreaking all sorts of havoc on people. So that is just very important. Please make sure you pay attention to the source, because we just don't want you to have the wrong information. And because of that wrong information, somebody in your family dies. Also, we would be remiss not to say, everyone, please stay at home.
Yes.
Stay at home. Stay at home. Stay at home. Social distancing is serious.
Yeah. It's the best thing you can do. Stay at home. If you must go out, wear a mask. But a mask is not protective. A mask in no way means now that you have it on, you can't get the virus. You can. Stay home. Keep your kids at home. Do homeschooling as much as you can. Stay home. No traveling either. Don't get on a plane right now.
You also made a good point, Dr. Renee. So we are like 3 weeks into this thing, and the coronavirus pandemic is causing 4 weeks. It's causing lots of anxiety and depression. So I think we need to talk about the mental health effects of this thing. It's causing lots of anxiety and depression, especially in those who already have underlying mental health disease. So there are a few things that you can do to try to protect your mental health. And one thing is to limit the amount of information that's coming in. Make sure that you check the source of your information. Don't be looking at the WhatsApp doctors. As Dr. Renee said, look at the CDC, listen to the actual medical doctors who know what they're talking about. Maybe set aside 1 or 2 times during the day when you turn on your television or look at social media. I know my social media timeline is filled with reports of people being sick and dying, and sometimes it becomes too much. Now is also the time to stay connected to people. Even though we have to practice social distancing, doesn't mean that we need to be cut off from our families and our friends. So I've been using a lot more video calling, FaceTime. I make sure that I talk to at least one friend or a family member every single day, just to try to stay connected, because feelings of loneliness and isolation can trigger depression during this time. And now is the time to also practice good self-care. Choose one thing that you can do each and every day just to make yourself feel good. That could be reading a book, listening to your favorite music, journaling, just tapping into any of your hobbies during this time. If you like to paint. If you like to write, do whatever you can to support your emotional health during this trying time.
Thank you, Dr. Kelly. That is very, very, very important. And if you are having some trouble getting through this time, there is also help out there for you as well. There's all sorts of hotlines you can text and call, crises hotlines you can call. So if you do need to speak to someone, there's a lot of mental health professionals that are very, very busy at this time, but they are out there for you. So you can do telemedicine and you can talk to them so that you don't have to feel that way. And you can talk to somebody and hopefully get over, get out of that depressed mood, and they can help you with some other things that'll help you to tolerate this time, because we're all tolerating it. I'm sure no one is really enjoying it, but we're going to tolerate it, and we'll all get through it. At the end of the day, we will all get through this.
And I just want to say quickly, what Dr. Kelly mentioned about self-care is very important, especially if you are a parent, because children pick up on whatever the parent is experiencing, okay? So for your health, for the health of your children, make sure, again, limit social media, limit, the TV being on. I'm here by myself, so I have the TV on all this. But I even have to like say, okay, enough, Randi, this is enough. But especially if you have children, because they're anxious, they know this this virus. They know that it's causing a lot of disease and just bad things. That's how they see it, as bad things. You know, I had a parent like text me, a former parent of mine. Her son said, oh, you know what, please call Dr. Randi. I don't want my doctor to get sick. So they know and they realize and they know exactly what's going on. So however structured and peaceful and calm you make your environment for yourself, your children are going to pick up on the same thing as well.
Absolutely. Agreed.
I agree as well. And it's amazing what they know.
Yes.
They know a lot. Don't they know. And I mean the youngest know.
Yeah.
So thank you all so much. This has been fantastic. I've been sitting in the wings and I've heard such great information. So I hope that everybody watching has really enjoyed it and learned some things. I had a question for the docs. So here goes. So when we migrate, we leave the Caribbean and go various places, we all tend to congregate in one place. So Brooklyn, certain areas around Miami, certain places in England, Canada. We have a lot of people in Toronto. So what is it that we can do to protect those communities? Because we're all there together, we're all interacting with each other, and an outbreak in one of our sacred spaces, you could call it, could really devastate the community. So what do you suggest that we do?
I think we need to encourage all of our community to social distance. As much as we want to, get together for church, we want to get together, for different fetes or whatever. Come on, we need to just take these few weeks that they're asking us to and just social distance. Get to know your family better. And once again, one day we will all be able to come together as a community again. But can we just social distance and stay at home?
Yes, believe what you're hearing and follow the recommendations. Don't ignore it, and don't fall into a false sense of invincibility. Anyone can be hit, and we've been seeing a lot of members of the Caribbean diaspora in New York City, for example. We're seeing reports of them dying. At least 8 Trinidadians have passed away already in reports from New York, 7 from Jamaica. It's hitting the diaspora hard. We're not immune.
And also, there's some conditions that are have a higher incidence in us, like diabetes and hypertension and obesity. And these underlying conditions increase your risk of having severe outcomes from COVID-19 or even death. So now is the time for you to make sure that your blood pressure is under control, to make sure that your blood sugars are under control. And if you can lose some weight during this time, lose some weight.
Yes.
I just want to end by saying, definitely take this very seriously. I mean, when it comes to this, I'm really blunt about it. I say, because I'm in New York City, so I see it. I see what my colleagues are going through. Once you hit that emergency room door, you are on your own. You're by yourself. Friends and family, we love to gather. We love to be supportive of one another, but that's not going to happen. Once you get to the emergency room, that's it. You're on your own. There are people who are dying by themselves with no family and members around them. So do whatever you have to do to protect yourself, social distancing, washing your hands, doing what's recommended for you. Take it seriously. It's not a joke. It is not a joke.
So thank you all so much for coming on and doing this and, giving your time to the community right now. It's very, very important. So I thank you so much for your work. What I want to do now is make sure that everyone has a chance to get to know you and find out more about the other work that you're doing. So we'll start with Dr. Kelly. Can you tell us what you're working on, what your current projects are, and where we can find you?
Great. Thank you for having me on your summit. So like I said earlier, I am Dr. Kelly. I'm your board certified endocrinologist. I treat patients who have diabetes and other hormonal conditions. I'm also a women's bounce back coach. So I help high performing women overcome past hurts to have a happy, fulfilling relationship. And I want to talk about my book. You can find it at drkellysbook.com. So I wrote this for that successful woman who is killing it in the boardroom, the exam room, killing it at her job, but making poor decisions when it comes to her relationships. This book will teach you how to recover from a failed relationship, how to work on your self-esteem. And I know a lot of you guys have some time to read right now. And I think the concepts in this book will help us to even recover from what's happening now with COVID-19. So please take a look.
Okay, and now Dr. Cindy, let's hear what you're up to and how we can find out more about what you're doing.
Well, the truth is I'm up to a lot of things. So I would say the best way to find out about me is to come to my website, drcindyduke.com. You can learn all about my clinical work, my work on women's health, my work in telemedicine, my work in virology, and my podcast, Girl Powered Success and Survival International, which is part of my broader mission to empower women and girls around the world by teaching them all about the different career options, even the ones in the often less traveled path. And so drcindyduke.com, everything you need to know about me is there and then some, plus you can communicate with me directly through that.
Wonderful. Okay, so next, Dr. Renee, tell us what you have going on.
Hi, as I mentioned, I am a doctor, but I don't practice. I talk about health and media. You can find everything on my website, askdrrenee.info. I have an online show called the Ask Dr. Renee Show. My mission is to motivate and inspire you to live the life that you deserve. That's my hashtag, live life you deserve. I want everyone to be happy because let's face it, we do not have a dress rehearsal. This is the only life we have to live. So we need to do whatever it is to make sure that we're happy today and right now. I am working on, because everyone is live streaming, I'm working on a course for live streaming so that I can help people to look just as fabulous as Eva has made the summit look. Everyone else's live streams could look just as great too, from their homes, from their cameras, from their computers. So I want to teach you so that you can learn how to do that as well. But you can find everything on AskDrRenee.info. You can also communicate with me through there as well. And I'm on all social media at Ask Dr. Renee.
Thank you. Thank you. Now, when that course comes out, I'm going to need all y'all to get it because seriously, I've gotten so much advice. So there's...
Me too.
Yeah, right. You are enjoying this summit on the recommendation of several technologies that I got from Dr. Renee. So these aren't just doctors, guys. These are authors. These are mentors. They're, just amazing people. So, Dr. Randi, it's your turn. We'd all like to hear what you've got going on.
Okay, so I'm Dr. Randi. As I said earlier, I am a board certified pediatrician and financial wellness expert where I provide your RX to wealth and well-being. And you're probably like, well, where does the finance come in? Before I was a doctor, I worked for 14 years on Wall Street. I left my career as a vice president for a very, very large financial services company. Everyone knows it. So anyway, but yes, I have a book. I wrote a book last year called Ladynomics, A Woman's Prescription for Wealth and Financial Well-Being. And I think this book is actually essential right now because not only are we dealing with this virus and, trying to stay healthy, physically healthy, we're also trying to stay financially healthy. Many of us have been laid off. Everything, our financial world has just went berserk. So this book will provide basic knowledge on how to save as much money as you can, how to get by on these lean months that are ahead. And you can find me at ladynomicsbook.com. Actually, all my products are there. I also have a coaching program, and I am running a special 20-minute financial strategy session on whatever topic you want to discuss. For $59, 20 minutes, and you can find all my products on ladynomicsbook.com, or you can follow me at Dr. Randi B MD drrandybmd.com, drrandybmd.com, where you find all my information and where you can stay in touch and communicate with me.
Well, everyone, thank you so much for doing this. This has been phenomenal. I hope that everyone will check out all of the websites. If you look on socamomsummit.com, I have everybody's bio, as well as links to get to everything if you didn't catch it while it was on the screen. So do we have any last words that you want to share with each one of you want to share?
I just want to say, wash your hands and stay at home, and we will all get through this.
I also echo that, this has been a tough time for everyone. I know personally, I have a family member who has COVID-19. One of my best friends, her mom is really sick in the ICU with COVID-19. So it's tough for everyone. Just reach out to people who might live alone, reach out to the elderly who don't have anyone to take care of them, volunteer to go get them their groceries or their medications, and we will get through this together.
We are a resilient community, and so rely on that resilience. And like Dr. Kelly and Dr. Renee said, we will get this, we will get stronger, but we have to support each other while we're waiting for this to resolve.
And I just want to say, use this opportunity to bond with each other, get your affairs in order, bond with your children, read that book that you wanted to read, put that business plan together that you've always wanted to do. Use this, try to find an opportunity in all this so that, because we will get out of it, and, just try and use this time to bring your life to the next level.
Thank you, Eva. This has been amazing. And I can't wait to see the rest of the days that we have, because this is a 2-day summit. So I can't wait to see the rest of the panels. Thank you so much.
And thank you all for doing this. I really appreciate it. So everybody, you will see them around the internet. Take care. Bye.
Bye.